Very much, Janice. Well, it is time now to review Medicare plans. If you're affected by that, it could save you thousands of dollars by doing so. And Kimberly Reynolds from the Welch Group joins us to talk about this, and also some changes that people need to be aware of that are happening pretty soon. So good to have you with us. Let's start off with that. So let's talk about the deadline, though, to make changes to your plans.
So the open enrollment starts October 15th and it ends on December 7th. So you've got that timeline to review plans and make a change.
Okay. And what about some changes that people need to be thinking about?
So you need to decide, you've got two options. You've got Original Medicare, which is the most comprehensive, where you have a Medigap plan and a prescription plan separate. The big change that will occur is after 2019 enrollment, there's one plan that will no longer be available, and that's Plan F. Okay. Plan F is the most comprehensive. It's considered the Cadillac plan. And so you have no cost out of pocket. You pay a premium, but you never pay anything for services. So if you want this plan, you need to enroll in it this year before open enrollment ends so that you can have it, because once you're in it, you're grandfathered in, but you cannot enroll after 2019.
Okay, does that, the Medicare Advantage plan, that's something separate?
So your option 2 is Medicare Advantage. Medicare Advantage combines all the components of Medicare into one, so you have your medical and prescription in one. Now these plans are great for people that are healthy and want to pay little or no premium out of pocket monthly, but when they go to have services done, they share that cost. They pay co-pays when they have something performed or done.
If people want to find out more about their prescription prices and maybe the best plan that's best for them, where can they get that information?
So you want to use the best resources, Medicare.gov, and you want to review the plan, because the prescription plans, there's over 25 plans available typically in every county in Alabama. You want to look at which plan is best for you, and it's all based on your particular situation, what prescriptions you take and what pharmacy you use. And it can save you thousands of dollars, and it's worth looking at each plan and making sure you've got the right one.
All right, so let's say, what if I get a plan here during open enrollment, but then my situation changes? Am I locked in then for the year?
You have a couple exceptions. Mainly you're locked in, but if you move to a different area, then you're allowed to change based on what plans are in that new county or where you move. Or if you have a plan and you're unhappy and there's a 5-star plan available in your area, then you can switch it. But the catch there is there has to be a 5-star plan available that allows you to switch into it.
Well, somebody may say, well, look, and I've been happy with the plan I've had, I feel no need to change it. What would you say to those folks?
I would say you still need to review it. You may stay with those plans, but the plans change every year. So you don't know what has changed. You've got to be diligent in looking at it and making sure it's still the best plan going forward for you.
All right, Kimberly Reynolds, some good information out there for folks in open enrollment. Thank you so much.
Thank you.
All right, a little bit later, we're going to talk about health news.